From the PEP Radio Newsroom, this is the evening news blast for May 20th, 2025. Annual COVID-19 shots for healthy younger adults and children will no longer be routinely approved under a major new policy shift unveiled Tuesday by the Trump administration. Top officials for the Food and Drug Administration laid out new requirements for access to yearly COVID shots, saying they'd continue to use a streamlined approach that would continue offering them to adults 65 and older, as well as children and younger adults with at least one health problem that puts them at higher risk. But the FDA framework urges companies to conduct large, lengthy studies before tweaked vaccines can be approved for healthier people. In a framework published Tuesday in the New England Journal of Medicine, agency officials said the approach still could keep annual vaccinations available for between 100 million and 200 million people. The upcoming changes raise questions for people who may still want a fall COVID-19 shot, but don't clearly fit into one of the categories. Is the pharmacist going to determine if you're in a high-risk group? Asked Dr. Paul Offit, a vaccine expert at Children's Hospital of Philadelphia. The only thing that can come of this will make vaccines less insurable and less available. The framework is the culmination of a series of recent steps scrutinizing the use of COVID shots and raising major questions about the broader availability of vaccines under President Donald Trump. It was released 2 days ahead of the first meeting of FDA's outside vaccine experts under the Trump administration. Last week, the FDA granted full approval of Novavax's COVID-19 vaccine, but with major restrictions on who can get it. And Tuesday's guidance mirrors those restrictions. The approval came after Trump appointees overruled FDA scientists' earlier plans to approve the shots without restrictions. Pfizer and Moderna, which make the most widely used COVID-19 vaccines, didn't immediately comment. For years, federal health officials have told most Americans to expect annual updates to COVID-19 vaccines similar to the annual flu shot. Just like with flu vaccines, until now, the FDA has approved updated COVID shots when manufacturers provide evidence that they spark just as much immune protection as the previous year's version. But FDA's new guidance appears to be the end of that approach under Health Secretary Robert F. Kennedy Jr., who has filled the FDA and other health agencies with outspoken critics of the government's handling of COVID shots, particularly their recommendation for young, healthy adults and children. Under federal procedures, the FDA releases new guidance in draft form and allows the public to comment before finalizing its plans. The publication of Tuesday's policy in a medical journal is highly unusual and could run afoul of federal procedures, according to FDA experts. Tuesday's update, written by FDA Commissioner Marty Makary and FDA vaccine chief Vinay Prasad, criticized the U.S.'s one-size-fits-all approach and states that the U.S. has been the most aggressive in recommending COVID boosters when compared with European countries. We simply don't know whether a healthy 52-year-old woman with a normal BMI who has had COVID-19 3 times and has received 6 previous doses of a COVID-19 vaccine will benefit from the 7th dose, they wrote. Guys, I hate to tell you this, but that seems like a really specific example. Not entirely sure most folks in the U.S. are 52-year-old women with a normal BMI who've had COVID-19 3 times. But then again, that's the news blast for this hour. If you're 18 or older, live in Pennsylvania, and are part of the LGBTQ plus community, we encourage you to visit paequality.com to take the Pennsylvania Equality Project's 2025 Housing Affordability and Sustainability Survey. Download the Live 365 app to take PEP Radio with you wherever you go. Up next is the local forecast from the National Weather Service for the Meadville area here on PEP Radio.